Welcome. We're glad you're here today. It is our mission to ensure the health and wellness of each individual so every person may reach their fullest human potential. Medical health is mental health. Mental health is important. Mental illness is nothing to be ashamed of. It is a medical problem, just like heart disease or diabetes. Mental illness can affect your physical health and can impact how you feel, think, and behave. Untreated mental illness can create challenges in your social, work, and family life. In the Latino and Armenian communities, mental health and mental illness are often not talked about, although mental health challenges are very common. For example, in the Latino community, 16% of Latinos report mental illness. That is over 10 million people. You do not have to suffer in silence. We are here to help. At CCHC, our medical staff, case managers, and behavioral health providers are ready to work closely with you to ensure you receive the best care possible. Our mental health and social services include individual counseling, child and adolescent counseling, substance abuse care, and patient resources and referrals. Medical health is mental health. Let's take a look.
Good morning, it's good to see you. I was wondering what brings you in today.
Good morning, doctor. Well, actually, I don't feel so good.
Okay, so tell me about that. What's been bothering you recently?
Well, I'm not sleeping very good. I'm tired all the time and I feel weak.
Gotcha, so you're tired, you feel weak, right? Any recent changes that you've been experiencing?
Well, yes. A little while ago, I lost my job, but that doesn't have anything to do with how my body feels.
Right, so I'm sorry you lost your job. I can imagine that could be a little bit stressful, but I do want you to know that our minds and bodies are connected, and they're gonna impact the way we feel and even our thoughts and our emotions.
Really? How are they connected when my body and mind are two different things? My thoughts don't hurt my body.
Yeah, so they can have like a physical response. Your body can have a physical response where sometimes maybe you might feel tired, right? Or some of the symptoms that you said, like weak or maybe a lack of sleep. So what I'm going to do is I am going to refer you to our agency therapist just so you can get the additional emotional, mental support to assist you. Is that okay with you?
Yeah, that sounds good. It actually sounds like both things do go hand in hand.
Most definitely, and I just want to commend you for the steps that you're taking, seeing me and being willing to see a therapist. Some additional things that you can do is exercise, make sure that you have friends around you, right, and that you're eating well, just to make sure that overall your physical, emotional, and mental health are supported.
Thank you, doctor, for your time.
Yeah, I'll follow up with you in a week and we'll see how you're doing.
All right.
Mental health challenges are common in the United States. 6.8 million Americans suffer from anxiety, and 16.1 million Americans suffer from depression. What is anxiety, you might ask? Anxiety is intense, excessive, and persistent worry and fear about everyday life activities. You may feel nervous, restless, or tense most of the time, feel a sense of danger, panic, or doom, have an increased heart rate, breathing rapidly, sweating, trembling, feeling weak or tired. You may even have trouble concentrating or thinking about anything other than the present worry. What is depression? Depression negatively affects how you feel, the way you think, and how you act. You may feel sad for most of the day. You may feel tired with lack of energy most of the time, feel worthless and guilty, feel hopelessness, have a hard time focusing, remembering details, and making decisions. You may even have trouble sleeping, or you may sleep too much. Have almost no interest or pleasure in daily activities. You've lost or gained weight without even trying. It's important for us to have a safe space where we can be free, allow ourselves to be vulnerable, and watch ourselves grow. Remember, we are here to help. At CCHC, we offer a safe environment that is confidential and culturally inclusive. We have individual counseling, child and adolescent counseling, substance abuse care, and patient resources and referrals. Remember, we have accessible mental health services. Let's take a look. Hi, Mary. My name is Samantha, and I'm one of the behavioral health specialists at CCHC. Thank you so much for meeting with me today. It's a pleasure meeting with you. How are you doing?
I'm actually not feeling so good. My doctor referred me to you, but I don't know how you're going to help me out.
Yeah, absolutely. That's one of the questions that a lot of people have, so you're not alone. You know, a lot of people wonder, what is mental health and how can it improve my life? What can I do to improve my emotional well-being? So thank you for taking the steps in the right direction and coming to talk to me. And looking at your referral from your doctor, he mentioned that you were feeling some anxious feelings, stressful feelings. Can you tell me a little bit about if there's been any sudden changes in your life that's causing that stress and anxiety?
Yeah, I actually lost my job. My boss found out that I'm undocumented. That is causing a lot of stress, anxiety, I'm losing sleep. So I'm very stressed out at this point.
Yeah, I'm so sorry to hear that you lost your job and of your legal status. I'm sure that sounds like it's causing a hindrance in your emotional and physical well-being with the lack of sleep and constant worry. I want to show you that you're at the right place and we're here to provide that support. Thank you so much for trusting in me and telling me something so delicate. I want you to know that what your legal status is completely confidential with me. It doesn't have any bearing on the services that you're going to receive. And as a matter of fact, we could link you to our case manager who helps with legal services and other community resources out there that could supplement assistance for your family at this time. How does that sound?
That actually sounds so good. I look forward talking to you more, and you make me feel comfortable.
Well, thank you. Thank you for taking the step in the right direction, trusting in me and CCHC to deliver this service. And now a message from our medical team.
Hi, good afternoon. My name is Araceli Toscano, and I'm the clinic administrator for our Glendale clinic. One of the reasons that I've decided to go into healthcare is because it has a broad spectrum of ways that we can impact people's life from different ways, with all of us having the same goal. One of the things that I would like to accomplish for my patients would be that we can provide them with timely, compassionate access to care while in our clinics.
Hi, I'm Ara Arapetian. I'm Medical Director at Comprehensive Community Health Centers. The reason I choose to become a physician because I enjoy caring for people. I like to empower my patients to take over their health and, simply speaking, to save lives. The impact I'm hoping to have on my patients is helping them to minimize their pain, recovering faster from their disease, and learn how to live with chronic and disabling conditions. Thank you.
Hi, my name is Antonia Suleiman. I'm a family nurse practitioner. I work for CCHC. I'm at the Island Park Clinic. The reason why I chose to become a family nurse practitioner is to care for the wellness of my patients, which also includes taking care of their mental well-being. We provide a very beautiful care here, and I love it, and thank you so much.
Hi, my name is Robert Barraza. I'm a physician assistant, and I work at the Eagle Rock Community Clinic with CCHC. The reason I chose to become a physician assistant is to provide medical services for communities like my own that we would consider underserved. The impact I hope to make on my patients is to support them, to encourage them, and to empower them to ultimately take control of their own health, especially as it pertains to their medical well-being, but also to their mental and social well-being.
Hi, my name is Marcela Roldan, and I'm a social worker. I'm a clinical social worker. And the reason why I chose to be a social worker is because since I was very young, I felt the need to connect to the world and to connect to people and be someone that can help them be a better version of themselves, and the same way that I have learned from so many people that I have worked with through the years. What I do is I work in comprehensive community health centers as an associate clinical social worker, and I do therapy. I do psychotherapy in 2 of our clinics. One is the Highland Park Clinic, and the other one is the Eagle Rock Clinic. What I want to do in my role here is to be able to provide support to our patients that are in need of that support, psychological support, emotional support. I want to be, for them, I want to be that person that can bring that support to them, that can help them through their problems, that can be somebody that listens and that gives them the attention that they need when they're going through a difficult time. So that's my role here. Thank you.